Onghala residents are forced to walk long distances to Onghala Hospital, a journey even more challenging now that it requires moving through flood waters. They dread when relatives fall sick, as they do not have the means to cross the river Pens. Even those with vehicles do not want to risk it. Village headman Paulus Frederick told the NBC News team that the nearest clinic at Onghala lacks staff. He thus called on government to accelerate the necessary logistics to ensure this is resolved.
We had made a request to at least get a nurse this side for the duration of the floods, but it has not been addressed. Government sometimes is slow at answering to people's concerns, but you will just see no solution until the water subsides. The situation is no longer acceptable. Some people are old, and even if you go to the hospital on their behalf to get their chronic medication, the doctors might not give them to you.
While happy that water levels in some parts of Onghala constituency are dropping, navigating through the water to access basic services remains unavoidable.
How can that old man go to the hospital? We were told to walk to the nearest gravel road so that we can get a car to come and assist this man yesterday. We went there and the story changed. Apparently, he will be airlifted, but to date, there has been no helicopter. At least the ambulance came today, but we need community nurses to... Our grandfather is disabled and he wants to go to the hospital. That car is too small, it's not a 4x4 and cannot pass through the water. Instead of these people to bring along nurses, they only send us paramedics to pick up the people who are sick. How does that help?
Contacted for comment, Onghala Health Director John Hango says the ministry has put up an outreach program to assist affected villagers at the Imbadalunga, Engava, Shikeva, and Onghala A and B. The program, though, operates pending availability of suitable transport for the healthcare workers. At present, he said the ministry depends on the NDF chopper to reach out to those cut off from more accessible areas. Ndapanda Shuya, NBC News, Onghala B.